Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to revisit a topic that I've talked about before as soon as we knew, and that is blood sugar, diabetes, and COVID. And we've known early on that high blood sugar was a demon when it comes to COVID outcomes, hospitalizations, ICU, ventilation, and death. And so the data we have now has not changed. It's just become that much more clearer. And unfortunately, I don't think this message is getting out. So it's not just diabetes, it's not just obesity, it is uncontrolled diabetes, it is obesity with elevated blood sugar. And then here in Arizona, we were well aware of just how bad things were in the Navajo population. And that's because they have a tendency to run other factors as far as smaller households, some homes still didn't have running water, but also the notoriously high blood sugars that can happen in some of that population. So all of that completely makes sense. Again, we've always wanted to make COVID into this mysterious respiratory virus that does strange things and we have no idea what it does, and it just strikes out of the wind, but that is just continually being shown to be not true. And in this particular case, this story about elevated blood sugar and elevated blood sugar and COVID continues to be a dire message. And I do believe that if we had said early on that we need to manage our blood sugar, I would prefer with diet. We're going to talk about now about which medications that's not a good idea for or to use. And I think we could have changed a lot of outcomes with COVID if we had educated people about just how important this was. Because we all know it's good. If you're diabetic, you know that keeping your blood sugar under control is important. But if you knew that your risk of dying went up 1,000-fold, then maybe you might have made different choices. Again, we can't force people to make choices, but if they realize just how dire the consequences are, maybe we would have had some lives saved if we got that message out. To date, I still haven't heard that elevated blood sugar is a nasty combination with with COVID. I've certainly heard that diabetes and obesity and high blood pressure, but not specifically the high blood sugar. And every diabetic most diabetics should be aware of where their blood sugar is. So in this particular study, it was presented as a paper at one of the conferences, and they looked at 2,000 diabetic patients and their outcomes. And they found that those people who had blood sugar over 180, which is a pretty high amount, were 44% more likely to have a severe case of COVID. Like, that's pretty bad. That's a pretty strong number. One of the things I found very interesting, two things, is first of all, is a pre-exposure to steroids. So in other words, if they had steroids prior to being hospitalized for COVID, they were 49% more likely to have a severe case of COVID. Now that becomes a little dicey because we also know that low-dose steroids are probably are definitely one way we're better controlling COVID. But steroids for other things and high enough dosages to start driving up blood sugar is probably why this that link was there. So steroids are always a dicey proposition. They always raise blood sugar, and so it shouldn't be a surprise that it's somehow in there it was playing a role. But one of the things I found most interesting is they looked at different types of blood pressure medication and the risk of severe. And the fanciest new class of diabetic drugs are the SGLT2 inhibitors. So like Invokana is the drug, and they're the shiny new things that we're looking at. All of the research is looking for this class of drugs and for weight loss, and actually may protect the heart, which some diabetic medications actually lead to worse heart disease outcomes, which is crazy. But there's been a lot of research looking at this class of drugs as being like the life-saving drugs with diabetes. Turns out that if you're on those drugs, your risk of developing severe COVID went up 85%. Like it's as somebody who has always taught lifestyle and working and diabetes is something I understand really well, and how to help bring people's blood sugars under control, and I've always felt that lifestyle was the answer. Well, finding out that this class of drugs it's expensive, but it's the new shiny drugs, and it may actually protect the heart, and it may contribute to more weight loss, but then you run the risk of having a severe outcome with COVID. Always boils back down to the fact that lifestyle is the only answer that won't kill you before it saves you. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you know needs the information, and subscribe to the channel.